Hi everyone. This video will be talking about cleft lip palate and an investigation of lived experiences associated with this disorder. Orofacial clefts are relatively common congenital structural abnormalities which negatively impacts on the quality of life of the individual and can extend to family. It describes a divided section on either the lip or the roof of the mouth and occurs when the sections of the mouth fails to fully combine during early stages of pregnancy. The absolute cause of the condition is unknown, but it is acknowledged that a combination of genetics, environmental factors such as using certain medicines, alcohol consumption, diabetes, and smoking can attribute to the risk of developing this disorder. Orofacial cleft is an overarching category which mainly composes of cleft palate, cleft lip, and cleft lip and palate. Depending on the specific type of it may involve the lip, the roof of the mouth, or the soft tissues in the back of the mouth. The prevalence of each of these variants vary greatly from one another, with the incidence of isolated cleft palate to be the rarest form of orofacial cleft.
The incidence of isolated cleft palate varies from 1.3 to 25.3 per 10,000 births, depending on the geographical location. The highest rates of isolated cleft palate are observed in non-Hispanic whites in Africa, although the level of prevalence is consistently high in females compared to males. On the other hand, cleft lip, with or without cleft palate, affects 1 in 700 babies annually, and is the fourth most common birth defect in the United States. Most often, orofacial clefts are diagnosed after the baby is formed through identifying the abnormal features, although cleft lip specifically can be diagnosed during the second trimester of pregnancy by ultrasonography when the face of the fetus is located correctly. Sometimes orofacial clefts can be diagnosed by prenatal ultrasound, but there is no systematic screening for orofacial clefts. If successful, it can prove to be a significant advantage as it enables parents to prepare themselves emotionally and gain insight about the birth defect.
Apart from the difference in appearance, those with orofacial clefts can have difficulties with hearing, speech, swallowing, and have missing or additional teeth. Services and treatment for children with orofacial cleft varies depending on the severity of the cleft, the child's age and needs, the presence of associated syndromes or other birth defects, or both. Orofacial clefts can often require multiple surgeries to repair and reconstruct the lip and/or the palate. Primarily, the surgical procedure aims to improve the aesthetics of the child's oral region and may also improve breathing, hearing, speech, and language development. Although surgery alone can over time enable one affected by orofacial clefts to assume a more ordinary appearance, to effectively manage other conditions or difficulties which arise in the response to this disorder, a multidisciplinary approach which involves combined efforts of a pediatrician, orthodontist, speech therapist, and audiologist will ensure both a functional and aesthetic result. In terms of the aspects of communication, errors in speech production are due to abnormal structure and function of the orofacial structure and growth in addition to learned neuromotor patterns during infancy. Orofacial cleft-based errors in speech production are divided into two groups, obligatory and compensatory. Obligatory errors refer to errors due to the structural abnormalities including malaligned tooth and oronasal fistula and cannot be corrected through speech therapy unless the abnormality is fixed. Compensatory errors are those which occur due to maladaptive articulatory placements learned by children during the developmental period. Whereas obligatory errors cannot be amended through speech therapy, compensatory errors can only be corrected through it. It involves changes in articulation with consonants being difficult to pronounce.
The information following is based on the accounts of two young British female adults, Hannah and Gemma. People who are born with a cleft lip and/or palate often describe experiencing bullying during their middle to late schooling times. Their bullies are generally their peers rather than older people, and they often attribute the bullying to ignorance and lack of understanding of their condition. It is not uncommon for the bullying to be in the form of strange looks from their peers, which cause the individual with the condition to feel isolated and their insecurity exacerbated. They would much rather talk about their condition instead of the passive stance adopted by their bullies. Another phenomenon regularly experienced by those living with cleft lip/palate is the relaxed and more accepting culture at further education institutions. These people often report feeling more included and less judged by those around them while studying at university or college. They make friends easily within days and accredit this to others understanding human diversity and accepting people as they are, rather than judging them based on their appearance. It is also possible people are more aware and knowledgeable of cleft lip/palate and approach it with empathy and acceptance rather than with fear or disgust.
In relation to Hannah and Gemma's experience with cleft lip and palate, they both demonstrate similarities in their lived experiences with this disorder. A similarity between both Gemma and Hannah is that they have gained their confidence once they both left school. Gemma believes that she was bullied by other pupils when she was younger as they were not aware of why she looked different compared to the others. Hannah believes she was bullied as she attended an all-girls school where most of the girls were heavily self-conscious. Although both women faced these experiences when they were younger, they had positive experiences while in college. Both Gemma and Hannah felt that the college environment was more accepting, hence making it easier to connect with others. Also, young adults had more awareness and were willing to ask them, which made both women feel more comfortable in these surroundings. Another similarity that was pointed out was both Gemma and Hannah have a supportive network of family and friends. Gemma's family and friends gave her the motivation to succeed in her ambition to pursue a career in teaching children. Hannah's family ensured they treated Hannah equally as other siblings so that she did not feel different with the way she looked. Also, Hannah's friends were a reason as to why she chose to attend the all-girls school, indicating she valued their relationship.
On the other hand, there were differences that the two girls faced in relation to their disorder. A difference between both Gemma and Hannah is the healthcare services they utilized and were aware of. Gemma was comfortable asking questions to health professionals regarding her treatment and her phobia of needles. For her jaw alignment surgery, she consults a psychologist, so she is more mentally prepared before she has her surgery, whereas Hannah was not aware of the psychological guidance prior to her treatment when she was 19 years old. She felt that if she had known of these services, she would have been able to cope with the changes the surgery gave her in a better manner. She only was able to access the psychological guidance after her treatment. Another difference between both of these women is their choice of career. Gemma chose to pursue a degree in primary education, whereas Hannah chose to pursue a degree in creative and expressive arts. Gemma feels her career choice has allowed her to open up to others and express herself as she is constantly meeting new people. She feels that it pushes her to speak up, which in return has boosted her confidence. Hannah feels her career choice allows her to express her thoughts and feelings in the form of music. She feels that she is able to change people's judgment of her when she performs, as initially they make a judgment by looking at her cleft lip. Hannah's career allows her to reflect on her personal experiences and have as a coping mechanism.
In conclusion, cleft lip and palate is a condition that can have different impacts on an individual's life. It is a condition which some individuals find tests their confidence and fears. It can challenge the individual's self-perception, career choices, and willingness to be open with others. The condition can significantly impact mental health depending on the environment the affected individual is within. Therefore, it is important that awareness of the condition is created so that these individuals are not isolated or judged upon for something beyond their control.